Did a novel coronavirus originate in a laboratory? On April 8, 2020, fairly early in the introduction of a novel coronavirus to American shores, Catherine Schaefer at the Pew Research Center wrote, while a plurality of Americans, 43%, say the new coronavirus most likely came about naturally, nearly 3 in 10, 29%, say it most likely was created in a lab. According to Pew Research Center surveys conducted from March 10th to 16th, 2020, as a part of the center's nearly year-long election news pathways project. Around a quarter of adults, 23%, say it most likely that the current strain of coronavirus was developed intentionally in a lab. Another 6% say it was most likely made accidentally in a lab. A quarter say they aren't sure where the virus originated. Hello, my name is Major Mike Webb. On June 13, 2020, Ben Guarino, Chelsea Janes, and Ariana Yunjung Cha reported for the Washington Post in a widely syndicated article about a then recent study sponsored by the World Health Organization on non-medical grade facial coverings, wrote at the outset that months of discord about the coronavirus epidemic have transformed the cloth mask into a potent political symbol, touted by Democrats as a key part of communal responsibility, labeled by some GOP leaders as a sign of government overreach and as a scarlet letter penned on the weak. And many, most often progressives, have questioned how a public health crisis might become political. Well, over 3 decades ago, I had the opportunity to serve as the aide-de-camp to the commander for U.S. Army Strategic Counterintelligence in the continental United States, as well as to serve in a follow-on assignment as the operations officer for the same military intelligence activity, echelon above Corps, where I had the further unique opportunity to play a critical staff role in the formation of the Armed Forces Medical Intelligence Center, or AFMIC, the precursor to the National Medical Intelligence Center, or INMEC, which was reported by ABC News in April 2020 as being credited with having alerted the former president about an emerging public health crisis in the central mainland of China as early as November 2019. So of record, I have a little head start by about 30 years on coming up to speed on the evolving science of this unprecedented global public health crisis. And I have been in court since the beginning of the pandemic, going through many of these theories. And while we can get back to my experience in later installments, for the next few minutes we shall be examining the competing claims and theories that have gained attention in the press. But bearing in mind that according to Catherine Schaefer at the Pew Research Center on July 24, 2020, most Americans, 71%, have heard of a conspiracy theory circulating widely online that alleges that powerful people intentionally planned the coronavirus outbreak. And a quarter of U.S. adults see at least some truth in it, including 5% who say it is definitely true, and 20% who say it is probably true, and that in their study they have found that educational attainment is an especially important factor when it comes to perceptions of the conspiracy theory. Around half of Americans with a high school diploma or less education, 48%, say the theory is probably or definitely true, compared with 38% of those who have completed some college but have no degree, 24% of those with a bachelor's degree, and 15% of those with a postgraduate degree. And that less educated Americans are more inclined to see some truth in conspiracy theory that COVID-19 was planned. So immediately those who believe in laboratory origin theory and a pandemic suffer a sharp disadvantage just in terms of perception of their educational background and perception of their scholastic aptitude, which figures most prominently in a debate that is about any topic involving science. And when going against government in court, you must worry about regulatory deference, where a government agency in charge of science is going to be taken as correct, as long as it is even debatable whether these facts are correct or not. Not surprisingly, Pew Research Center also found that partisan affiliation also plays a role in perceptions of the theory. About a third, 34% of Republicans and independents who lean to the GOP say the theory that powerful people intentionally plan the COVID-19 outbreak is probably or definitely true, compared with 18% of Democrats and Democrat leaners. And by July 2020, according to Pew Research Center, regarding news about a COVID-19 planned conspiracy, 72% of Republicans had heard of the claim, compared with 70% of Democrats. Pew Research Center observed that conservative Republicans are especially likely to see at least some truth in the theory. Roughly 4 in 10, 37%, say it is probably or definitely true. This contrasts with 29% of moderate and liberal Republicans, 24% of moderate and conservative Democrats, and 10% of liberal Democrats. Additionally, by July 2020, it was found that roughly a third of black, 33%, and Hispanic adults, 34%, say the theory is probably or definitely true, compared with about 2 in 10 white adults, 22%, and Asian Americans, 19%. And women are slightly more likely than men, 29% versus 21%, to see at least some truth in the conspiracy theory that powerful people planned the outbreak. On July 22nd, 2020, Alex Tyson at Pew Research Center had found that Democrats and Democrat leaners are far more likely than Republicans and Republican leaners to say COVID-19 presents a major threat to their own health and finances. And further, that particularly majorities of black and Hispanic adults, 57% each, view the coronavirus as a major threat to their own personal health. By contrast, 46% of English-speaking Asian Americans and just 33% of white adults said this, and that lower-income adults were much more likely than middle and upper-income people to see COVID-19 as a major threat to their own health and finances. Similarly, by June 3rd, 2020, Carrie Funk and Alex Tyson at Pew Research Center had found that about 6 in 10 Americans, 59%, viewed social distancing measures, which are still in place across much of the country at the time of the survey, as helping a lot to reduce the spread of disease, although this belief was more common among Democrats, 69%, than Republicans, 49%. Similarly, while Democrats overwhelmingly rejected lifting restrictions too soon, Republicans tended to welcome the end of restrictions based upon their opinions on scientific methods that had been adopted by the government in response to the public health crisis. And again, as long as you're debating on Facebook or on the news, it doesn't really matter. But when you go into court and you have to deal with regulatory interference, you need to have some expert scientific opinions to back up what you say as evidence. In the current age, most Americans receive their news from echo chambers that align with their political and ideological perspectives, finding conservatives receiving their news about the pandemic on news channels like Fox News when they are conservative, and progressives finding their news content on outlets like CNN or MSNBC, which tend not to inform so much as to reinforce personal opinions consistent with political identity. And by October 28, 2020, Mara Mordecai and Aidan Connaughton at Pew Research Center had examined survey data from the U.S. and 12 other nations and found that in America, 3/4 said the country is more divided than before the coronavirus outbreak, regardless of whether or not they supported the current administration. And that relative to those in the other 12 nations surveyed, Americans were at least united in seeing divisions in their country. Now, around this time, actually before this time, in July of 2020, months before the elections, some 73% of Democrats were confident that they understood the science of pandemic, while 66% of Republicans were confident that they understood the science of pandemic, at a time when not even the scientists were confident that they knew the science behind the pandemic, and they still have questions. But persons who were being surveyed were confident that they knew the science. And on June 28, 2021, Steve Watson at Summit News reported, appearing on Fox News, Senator Rand Paul said, when you look at COVID-19, it doesn't even seem to infect bats very well. It doesn't infect an intermediate animal. They checked 80,000 animals at the wet markets in Wuhan. None of the animals at the wet market would accept COVID-19 or were positive for it. It looks like it's most well adapted for humans. So this is worrisome. And yet more evidence at this, in all likelihood, came from the lab, Paul said. I think if you look back at the last year and you look at the people who are discounting the theory that it originated in a lab, they are precisely the same scientists that were sending the funding to the lab. So there is a real possibility that they have a conflict of interest, Paul further noted. The senator has continually pushed back on anti-scientific statements regarding the pandemic made by Anthony Fauci and others, including Peter Daszak, who not only funded gain-of-function research, but has continually pushed for the lab leak theory to be dismissed by the scientific community while being appointed by both the World Health Organization and the Lancet Journal to investigate the origins of the outbreak. It is a very specific claim to state that when you look at COVID-19, it doesn't even seem to infect bats very well. However, in epidemiology, what amounts to a marginal infection in some species may present a larger problem for other species. And many in the scientific community have claimed that this, in part, was the genesis of viruses becoming a problem for infectious disease in the first place, which before COVID-19 had only produced a total of only 219 viruses harmful to mankind from amongst the most abundant biological particles in the world, infinitesimally small. And one would think that a doctor, although perhaps not an eye surgeon like Senator Paul, would know this. Similarly, cases of infection have been found in tigers, in squirrels, in many species for COVID-19, but that was almost a year ago. And on April 30th, 2022, reporting for Associated Press in the SF Gate, Bruce Schreiner in Smithfield, Kentucky, reported that seeking a third term in the Senate, U.S. Senator Rand Paul promised to wage a vigorous review into the origins of the coronavirus if Republicans retake the Senate and he lands a committee chairmanship. A promise contingent upon a condition that Republicans retake the Senate. And this report continues, stating, when we take over in November, I will be chairman of the committee and I will have subpoena power, Paul said. And we will get to the bottom of where this virus came from. The senator and eye surgeon continued to offer his theory about the origins of the virus. If you look at the evidence, overwhelmingly, not 100%, but overwhelmingly, the evidence points to this virus being a leak from a lab, Paul said. In the U.S., many conservatives have accused Chinese scientists of developing COVID-19 in a lab and allowing it to leak. Going into an election, the senator from the volunteer state is now resorting to more generalities about overwhelming evidence, but not being too specific, and promising that not only if he is reelected, but also if the Republicans take control of the Senate, he will then begin an investigation into a biological agent that, as of April 29, 2022, according to the World Health Organization, has been responsible for 510,270,667 confirmed cases of COVID-19, including 6,233,526 deaths worldwide, more victims than were credited to Adolf Hitler during the Holocaust. And Senator Rand Paul has consistently maintained that the virus had originated in a lab and promises if Republicans take control of the Senate, he will begin an investigation in the next congressional term. Is it possible to have a pandemic without political interference? Is it possible to have a pandemic without financial interests dictating outcomes? Did the pandemic only coincidentally accrue to the advantage of certain interests during the pandemic? Was the global public health crisis planned? Did the novel coronavirus originate in a laboratory? Or was it zoonotically evolved? These are questions we will begin to pursue in the upcoming installments, and they actually have very easy answers. The Director General of the World Health Organization has stated that we have learned that we underestimate this virus at our own peril. The CDC Director has admitted that this virus isn't stupid and that human choices have not served us well. And the President's top medical advisor has recently stated that this virus has fooled us before. And to date, over 881 million Americans have been infected, while over 990,000 fatalities have been attributed to a novel coronavirus of unknown official origin. This briefing is unclassified. As you were, my name is Major Mike Webb, and by God, I am running for U.S. Congress. This year, resolve to do the right thing, and we shall make America great again. Honest. Carry on. This advertisement was authorized by Mike Webb.